Hey everybody, and welcome to the Tea with Dr. T. And today I have our very own Dean Kim Christmon. Dean Christmon, welcome to the Tea.
Thank you. I am excited to be here.
Well,
and thank you for inviting me.
We're excited to have you. So share a little bit about your journey and how did you get to Vol State?
Okay. I've been here for a minute.
How long have you been?
I've been here for a little over 21 years.
Oh, so you do know the tea.
I've created a little tea. So many years ago, I was a full-time registered respiratory therapist at Vanderbilt Hospital, and I always loved having the students with me. And one of my colleagues recognized that I enjoyed teaching, and she told me about a position that became available here at Vol State as a clinical director. I interviewed for the position. It was not offered to me. However, they called me a week later and said, well, we have a clinical instructor position, and we think you'd be perfect. I came here as a clinical instructor, 9-10-month employee, did not even get to work out the term because the clinical director resigned. And so then they asked me if I wanted to be the clinical director. And I came on board in that aspect, did that for a few years, became the program director in 2016. The opportunity to apply for a dean position became available in health sciences. And I applied for that. And here I am today.
I love that. And I love that story that someone recognized early on your love for teaching, even though you didn't recognize that necessarily. And so isn't it amazing how our journeys are often shaped by what other people see of us, not necessarily what we see?
Absolutely.
So tell me about what you have going on in health sciences. How many programs do you have?
Let me just name those programs.
I think you should.
Dental assisting, EMS, and not just EMS, but all branches: basic, advanced, accelerated, paramedic, fire science, health information management and coding, medical laboratory technology, PTA, physical therapist assistant, radiologic technology, ophthalmic technician, respiratory care technology, sleep diagnostics, and diagnostic medical sonography.
That was impressive.
That's quite a bit.
And some of those words are big.
They are very big. And they are all vital areas of healthcare.
And how do you juggle an area that is that large, and all of those programs also have individual accreditation? Is that correct?
You're absolutely correct, with the exception of a couple of them. For example, fire science. And the way I handle this is I have a wonderful team. I love each and every one of them. Wonderful team of faculty and program directors who are very competent, who are very aware of accreditation requirements. And some of our programs also have state of Tennessee requirements as well. And so staying organized, staying knowledgeable, staying up to date with what's going on in the business industry, as well as from a standards perspective, are ways in which I'm able to keep things running, from my point of view, with the help and the toolage of the whole entire team, from adjunct instructors, full-time instructors, to the program directors.
It takes everybody.
It takes everybody. Ramona loves to say greater together.
Yes.
And we are, for sure.
And you mentioned something about our EMS program, and I know that you also almost have a dual capacity there with EMS, because we've got both our credit-bearing students and the students who come to us, and it's not necessarily a truly academic credit program, it's a non-credit program, but it's all the same work and certification. How does that work?
We have a non-credit coordinator, Mr. Sean Hill. This is a position through workforce development that is, I'm the supervisor for that particular position. And he does such a wonderful job with making sure that we not only hold wonderful cohorts of educational programming with the community, but he also ensures that he's able to recruit people through the local fire halls as well as ambulance services. So thank goodness we have him to help with the workforce side. On the for credit side, we have a team of 5 to 7 full-time faculty members in EMS along with a program director, in addition to a multitude of adjunct instructors who work together not just at one location, but 3 locations. We are here in Gallatin, we are in the Cookeville area, and we are also in Springfield for EMS. So EMS is really a full plate of programming. And we're talking hundreds of students a year.
And working both in the credit and the non-credit space, so we can give students opportunities based on what their scheduling is.
Absolutely.
Do you see that as an opportunity longer term in some of our health sciences programs where maybe not necessarily non-credit, but just in a very different structure than what we've always been accustomed to?
Yes, the Department of Justice, State of Tennessee, they are really supportive of apprenticeships. And I will be serving on 2 apprenticeship task force, one for MLT, and I forgot the other one. We haven't started meeting yet, but this is a way for me to be at the table with other leaders across TBR to come up with pathways for the non-credit side, because there's a lot of opportunity there. And then there are also ways in which, for example, with paramedic is an accredited program. So we do have students who are in apprenticeships who are in our paramedic program here in Gallatin, in Cookeville, and in Montgomery County, which is Clarksville, Tennessee. So being a part of a task force, having a seat at the table, attending meetings, getting more information is a great way to kind of develop a model, get enough information to develop a model for Vol State to be successful in helping people in the community who are interested in obtaining a credential or a degree, but not necessarily ready to be a full-time college student. And from an apprenticeship model, a lot of those are, the students receive they don't have to pay anything. So their employer may pay, or it may be some sort of a grant from the Department of Justice, State of Tennessee. So we've been very successful in that model. And I like to see it expand into other avenues where we can. It's not feasible for all healthcare programs due to different standards and things like that. But in instances where we could do some things, we would like to do some things.
And I love that. And I love you sharing a little bit of the tea, because the more innovative we can be, the more opportunities we can provide for our students.
Right. And I always remember community. That's why we're here. And
we
want to help the community college.
Well, y'all have heard it from Dean Christmon, and she's shared a little bit of her tea on the Tea with Dr. T.